Welcome to Rural Health Answers, a segment of our podcast, Rural Health Today, for you, our listeners, to ask questions only rural health experts can answer. Today, I'm here with Brian Peters, the Chief Executive Officer of the Michigan Health and Hospital Association. It's great to have him in the studio. We've just had a robust discussion about many issues impacting this country, in the state of Michigan as well, and how it impacts local hospitals that are rural, like Hillsdale Hospital. And those listening today need to tune into that because it's an important and very timely discussion about what you can do to lift your voices. But Brian, a question for you. How can hospitals effectively advocate for what they believe in without risking the trust of their community? Sometimes there's a divide there. You know, who represents the hospital CEO may not be in the community every day, raised and born there. They may be placed there for such a time. So how do they effectively advocate and balance the two?
Well, we always encourage our members to have their elected officials come and tour the hospital. But that same concept applies to key leaders in the community. If you want to build trust, invite those folks into the hospital. Don't wait until they're there with a healthcare condition that needs to be addressed. Have them come in and tour the facility, speak to your team, have them meet the doctors and nurses and administrators who are dealing with all of the many challenges that you deal with on a day-to-day basis. I believe that hospitals are the ultimate gem in America today. And unless you've had the opportunity to come and spend some time and see them firsthand in action, you don't fully appreciate it. And so I would really encourage that opportunity, to the extent it's possible, be granted to members of the community.
Great idea and amazing suggestion. One in which, I took up about 5 weeks ago, that very suggestion, and invited a gentleman here from out of town who moved here and wanted to know a little bit more about us. And so we gave him a tour. It's developing into an amazing friendship that potentially could even lead to, he's talking about making some contributions and investments in our community hospital. And so you never know what the relationship's going to yield, do you?
That's terrific.
Great. Thanks, Brian, for being here today. We appreciate you.
Thank you, JJ.
And thank you to our listeners for tuning in to this segment of Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.